Hello everybody, this is Dr. Alim from FDR's 7th Global Update, Hotel Marigold, Hyderabad. Today we have with us Dr. V. Srinivas sir. Sir is an acclaimed, famous senior consultant physician of Hyderabad. And sir, today we would like to know from you about practices of hypertensive patients in Ramadan. To start with, I would like to ask, can all patients of hypertension fast in the month of Ramadan?
Yeah, thank you, Dr. Ali. A very good question, especially in the context of Ramadan. Most of the patients who are diabetic patients are invariably hypertensive patients. Now, what are the important precautionary measures which they need to take or an hypertensive patients need to take in the period of Ramadan is we need to understand and assess what are the different class of medications they are trying to take. Like whether they are on calcium channel blockers, which are very much safer in hypertensive patients during Ramadan fastings, whether they are beta blockers, with an ARB drugs, with the drugs which includes the drugs like diuretics, like trimetazole plus hydrochlorothiazides or diuretics alone. So what usually happens in the phase of Ramadan, in the prolonged fastings, there is a chance that they can go into a period of hypovolemia and hypodyselectrolytemia. What is it? Electrolyte imbalance. So a thorough history regarding the class of medications in patients who are taking antihypertensive medications is very important, and drugs which can be safely continued, drugs like calcium channel blockers, beta blockers. Especially we need to be more cautious in those patients who are taking drugs like diuretics.
So now I would like to know from you, sir, what dietary changes should a hypertensive patient do, especially in the month of Ramadan? Because the periods of fasting are very long.
Yeah. So that's very good questions. See what usually happens, the prolonged period of fasting is like more than 12 years gap, 12 hours gap between the two meals. And regarding hypertension, what one factor which is very important is salt intake. But fortunately or unfortunately, it is a predominant amount of glycemia which occurs usually in the period of fasting. They take plenty of fruits, plenty of sweets, which will cause a burst in the hyperglycemia phase rather than much of the salt. But one thing which they should not take more quantity is the amount of salt. Why? Because they are the drugs, especially in the group of people who are taking diuretics and they are prolonged fastings. There is a possibility of alternation electrolytes, changes in the sodium factors, going into hyponatremia, going into sensoriums. So they need to limit the amount of salt intake, especially in the periods of fastings, and take moderate amount of all other substances like carbohydrates, proteins, vitamins and minerals, but lesser amount of salt is very much advised in such patients, especially who are the drugs like diuretics and also the drugs like SGLT inhibitors.
Start, sir.
So finally, I would like to know from you, which is the category of the patients who can fast and who cannot fast in hypertension?
Yeah, very good question. So no one does not want to fast in the period of Ramadan. So a fit person, hypertensive, with no symptoms in lines of cardiac disease, with normal injection fractions, good LV functions, are almost fit to continue fasting Ramadan period. Only such patients who are at a compromise, who are symptomatic, irrespective of cardiac function, who are symptomatic, are not allowed to fast during the period of Ramadan. So who doesn't have symptoms but still their cardiac function is a lower side, who have got reduced ejection fractions, persistently on the group of drugs like ARBs, diuretics, SGLT inhibitors, are at a high risk of altered electrolyte imbalances, going into state of dehydration, going into state of impaired cardiac functions. So these category of patients are not to go into Ramadan fasting in all such scenarios.
So today we have been learning at FDRS about lot of things in diabetes like diabetes and depression, diabetes and Ramadan. Sir has also talked about hypertension in Ramadan patient. For more such updates, join us at FDRS every year. Thank you very much.
Thank you, Dr. Ali.